For decades, Maryland residents have had access to the nation's pioneering shock trauma center. Tonight in our Your Health segment, we'll focus on shock trauma's expansion and the important goal of keeping people out of that souped-up emergency room in the first place. Joining us now is Karen Doyle, Vice President of Operations and Nursing at the University of Maryland Shock Trauma Center. Thanks to you for being with us.
It's great to be here. Thank you.
Good to have you here. Let's talk about how things have changed. You go back a ways at this institution. It's grown a bit.
It has grown tremendously in many ways. In 1989, when our new building, that's what we still call it, the new building,
I remember
was
the
built,
previous building, but that's
right.
fine.
It was built to hold 3,500 patients. And now we're seeing greater than 8,500 patients on an annual basis. So the amount of people that need our resources has tremendously grown over the years.
What types of cases come to shock trauma?
Primarily, we see patients that are involved in motor vehicle collisions, but we also see soft tissue injury. We see patients that have sepsis, severe infections that come to us for our expertise. Our physicians are board certified in general surgery and critical care medicine, so they have a vast array of expertise available to them that many community centers do not have. So the communities will rely on us to help them with respiratory disorders, sepsis, and other things besides the motor vehicle collisions.
We're seeing footage of the helicopter landing on the roof and a patient being brought down the elevator. This all happens very quickly, but as we said at the top, it's something you really want to avoid if you can, and we wanted to focus on prevention a little bit. And when it comes to automobile accidents, you can't always avoid them, but there's certainly some things you can do to make it less severe.
There are many things that you can do to make it less severe, and so as you know, what's out today is don't drive distracted. So don't drive while texting, don't drive while you're on the telephone, don't drink and drive, don't drive while you're drugged. So there's all kinds of efforts that we undertake to prevent people from coming to our place to begin with.
Have the nature of those injuries changed over the years as automotive technology, we start getting airbags and different crumple zones in cars?
Absolutely. I mean, one of the things that really changed and transformed the types of patients that we see is the seatbelt law. When I first began many years ago, we didn't have seatbelt laws. So patients would get ejected, they go through windshields, and they had devastating facial injuries and things of that nature. Today, because of the seatbelt law, we don't see as many of those injuries. So the nature of the illness or the injury has absolutely changed. What
injuries does somebody come in with if they've been in a bad wreck?
They'll come in with, we see a lot of brain injury, so head injury, and which still happens in the motor vehicle collisions. We see spinal cord injury, we see chest injuries. In addition to motor vehicle collisions, we see industrial accidents, motorcycle collisions. We still get a small percentage of violent crime, so we'll see gunshot wounds, stabbings.
Let's talk about the new building a little bit. As we said, the current building I think of as the new building.
Right.
How is the new building going to be better?
So the new building will provide 60 more critical care beds, 10 more operating rooms, several more additional recovery rooms. So allow us to increase our capacity for patients that need us in the state of Maryland. But in addition, with a building that was built to serve 3,500 patients, and for us seeing 8,500 patients, it allows us to move patients through our resuscitation unit in a much more effective and efficient way. We'll be able to get patients to their ICU bed instead of staying in the TRU. So it allows us to be a much more efficient organization and to provide our families a much more compassionate and family-centered organization when they come into our center.
It's really its own hospital. It's
Yes.
certainly part of the University of Maryland Medical Center complex, but as you mentioned, you have people checking in. Not everybody comes in by helicopter. People are admitted in other ways for other reasons.
Well, patients will come to us, they only come two ways. They come via ambulance or they come via helicopter. They're the only two ways you get to shock trauma. And yes, we are a small hospital, and so we're different than any other trauma hospital in the entire country. We are a separate and independent organization from the emergency department.
Why do you think the model has evolved differently in other parts of the country? This is still the one and only shock trauma center.
This is still the one and only shock trauma center. We're fortunate in the state of Maryland to have had a group of legislators many years ago to really see and understand and value the concept of an integrated trauma system. So all over the state of Maryland, while we are the highest echelon of care, we're the primary adult resource center for the state of Maryland, there are 9 other trauma centers in the state of Maryland. So a patient will get to a lower level of care, and they get transferred to a higher level of care if needed. And so fortunately, our political system was able to see that this was a smart thing to do. Dr. Cowley, with his infinite wisdom and his ability to influence and persuade and to get people to understand that the golden hour is critical in your survival. We have a 97% survival rate if you get to us within, the appropriate time frame. And so we're fortunate as citizens in the state of Maryland to have this type of system available to us.
What can you tell us about the new building in terms of, a couple things, cost, timetable, and aside from the operational stuff, is there any other kind of whiz-bang technology that this will have that the current facility doesn't?
Yeah, there are a few things. First of all, the building will be finished in August of 2013. It cost us approximately $160 million. For the first time, we are looking for philanthropic support to help fund the building. So we have this huge capital campaign going now. And then in terms of, it'll have the latest and greatest of all the technology in the operating rooms and the ICUs. But one of the things that is very unique is our National Training and Simulation Center. This is a center that is a partnership with the military and the shock trauma team. We have a very cohesive relationship with the Air Force, called CSTARS, the Center for the Sustainment of Trauma and Readiness Skills. They learn their skills with us in the Shock Trauma Center so that they can get deployed to Afghanistan and be ready and available whenever our soldiers need them.
Very good. Karen Doyle, Vice President at Shock Trauma, thank you so much for coming by.
Thank you.
Appreciate the time. Thank you for joining us for Direct Connection. If you'd like to ask a question of a future guest, you can do it by video now. Go to mpt.org/directconnection/current, and the link is there to upload a video to our site. Thanks again for joining us for Direct Connection. We're back Thursday with Your Money in Business. Have a good night.
Your Health segments are a co-production of Maryland Public Television and the University of Maryland Medical System.